Welcome and thank you for standing by. All participants are on listen only until the question and answer session of today's conference. To ask a question, press star 1, unmute your phone, record your name, and I will introduce you. This call is being recorded. If you have any objections, you may disconnect at this time. I would like to now turn the call over to Lauren Slokowski. Ma'am, you may begin.
Great, thank you so much. So good afternoon, everyone, and thank you for joining us today for the Administration for Community Living's Business Acumen webinar entitled Creating Sustainable Solutions to Social Problems Through Social Enterprise. Again, this is Lauren Slokowski with ACL, and I will be facilitating our webinar. For our webinar today, we have invited Dr. Jay Greenberg from NCOA Services, LLC, and he's going to be presenting on the concept of social enterprise and its relevance in transitioning from a grant-based operation to a business-based environment, all while keeping the focus on achieving a social mission. So before we start with his presentation, I have a few housekeeping announcements that I would like to go through. So first of which, if you have not done so, please use the link that was included in your calendar appointment to get on to the WebEx so that you can follow along with the slides as we go through them, and also that you can ask your questions when you have them through the chat function. If you do not have access to the link that was emailed, typically I would say that you can go on to the webex.com, it's www.webex.com, and click the Attend a Meeting button, and then from there you can enter the meeting number. But however, as when Dr. Greenberg joined the conference, he let me know that the meeting number is not working. So if you are having trouble getting onto the WebEx, you can also call the WebEx technical support, which is the phone number is 1-866-229-3239. So it's 1-866-229-3239. As the operator had mentioned, all of our participants are in a listen-only mode. However, we do welcome your questions throughout the course of the webinar, and there are two ways that you can ask your questions. The first, through the web using the chat function that I mentioned earlier. You can enter your questions, and I will sort through them and answer them once the speaker presentation has concluded. The second way to ask your question is once the speaker wraps up, we will offer you, the operator will offer or provide instructions for asking questions through the audio line. So when that time comes, she will give us instructions as to how to queue up to ask your question. If there are any questions that we don't get answered during the course of the webinar, we will follow up with you following the presentation to get them answered. If you think of any questions, you can email them to me. I have included my email address in the chat box on the right-hand side of the screen within the WebEx. And also, as the operator mentioned, we are recording the webinar. We will post the recording, the slides, and a transcript of the webinar online for your reference once, usually within a day or so, once the webinar has concluded. So with that, I would like to turn things over to my colleague, Marisa Scalafoli, who will be introducing our speaker for today.
Good afternoon, everyone, and thanks, Lauren. This is Marisa Scalafoli, also with the Administration for Community Living, specifically our Office for Integrated Care Innovations. And I am thrilled today to introduce a longtime colleague, Jay Greenberg, to talk with us with regard to social enterprise. If you remember back to our in-person meeting back in April, when we were talking about issues related to organizational culture change and so forth, this topic of nonprofits thinking about themselves as social enterprises came up, and everyone was sort of intrigued by it, and we thought we should follow up and dive into this topic in some more detail. And so we couldn't think of anyone better to talk about this issue than Jay Greenberg. I had the good fortune of working with Jay for several years when I was working at the National Council on Aging, and he is an expert in this model of looking at social enterprise and how nonprofits can think about themselves as social enterprises and how those social enterprises can diffuse sustainable, scalable solutions to social problems. So that's what we're going to talk about today. Just a little bit of background on Jay. He is the CEO of NCO Services, LLC. NCOA Services partners with for-profit and nonprofit organizations to create and diffuse sustainable, scalable solutions to key issues facing an aging society. He also is responsible for setting strategic direction for NCOA's suite of consumer-facing web solutions and fostering social enterprise thinking throughout NCOA. So he's going to talk a little bit with us about this concept and about NCOA's story in this area. And so with that, I will turn things over to Jay.
Thank you, Marissa, and welcome everybody. I'm really excited to be able to share with you. If you can go to the next slide, and we'll sort of talk about the agenda. The reality is that we are all on this co-journey together. It just so happens that NCOA as an organization may have started it a little bit earlier, may have used some different names, but what's very clear is we are all on this journey together. And what I'd like to do is to share as quickly as I possibly can thoughts in three different areas. Thoughts about social enterprise and how we have been and currently think about it at NCOA. Thoughts about business planning and services, and thoughts about sort of selling and the sales process, et cetera. And literally, these really are just thoughts. I don't know what's on your minds in terms of which of these are the most important to you. So my goal is to get through the presentation part of this as quickly as is possible to leave as much time for rich discussion. I really do view this as the beginning of conversations and discussions. And if you can go to the next slide and then the next slide after that. It was really interesting to me that Assistant Secretary Greenlee's remarks at N4A dealt with the notion of moving from grants-based to enterprise-based services, with, of course, the question is of who's going to pay. And about 6 years ago, when we started actually our partnership that we referred to as a Healthy Aging Social Enterprise with Stanford, and helping to figure out how we could scale the online version of the Stanford programs, we really started at NCOA, started to dig into what does this new future look like? How can you achieve your mission and margin, and then take it a step further, and how could you ensure that you didn't have to trade off mission and margin, but was there a way of thinking about and structuring the way we did business with partners, particularly partners in the private sector, where there was no trade-off between mission and margin, but they were synergistic with each other, so that working with those partners, we actually achieve our social mission. And that led us to a certain definition for us about social enterprise. So if you can go to slide 5, the next slide, please. We really do believe that social enterprise provides that kind of framework, and it really is a framework, for making the transition, that the Assistant Secretary was talking about. And before I get into how NCOA kind of defines it, the whole area of social enterprise was actually created by a now Nobel Prize laureate for a very, very different purpose. It happened to be microfinancing in underdeveloped countries. But the principles underlying it, I think, are very, very important and key to any of the culture change that we all are going through in order to do this. So if you go to the next slide, it represents Yarnis's 7 characteristics of social enterprise, and it's really his model that we've based our work on. The first is that the business objective is to overcome a problem that threatens people or society. It's not to maximize profits. That said, the social need is addressed through profit-generating products and services themselves. And if that's working well, of course, then the endeavor does become self-sustaining. And of course, the key for the social enterprise is to think about stakeholders, not shareholders, but as we'll get to in a moment, your partners are going to still have to think about their shareholders. And of course, that the actions that are taken are environmentally and socially conscious, that the workforce gets market wages and better than standard working conditions. On this one, this is an interesting one, and we'll come back to it because when Yarnis first did this, it was in the context of very, very poor people starting these enterprises. But there's another meaning to that in the brave new world that we're all journeying in, and that is that the organizations that we are going to be competing with in order to get our staff and our colleagues are going to now be people that had experience and expertise in some aspects of the private sector, but who have a passion for social enterprise. And so the amount of dollars that we are going to have to spend in order to give them market wages is going to be different, and that is also part of the culture change. And finally, and this is a piece that is wonderful because it didn't have to change anything that we did or anything that people in the network do. It's done with joy. So let me now talk about, go to the next slide, NCOA's definition of social enterprise. And let me say that we came to this definition over about a 3-year process, and it really wasn't until about 3 months ago that it became so crystal clear, and our path forward with social enterprise became so crystal clear. It wasn't until 3 months ago that we actually now include it as part of the strategic overview of NCOA. So we define a social enterprise as organizations or partnerships that create and implement market-driven, self-sustaining solutions to social problems. It's a mouthful, but the key there is that the enterprise is there to solve a social problem. And a key to that is accountability. And the realization is that in this country, it means something different, for example, than it would mean in Sweden. So in this country, the fiduciary responsibility of a for-profit company, the fiduciary responsibility is to its shareholders. And that's the way, and that's the way we do business in the United States. It doesn't mean that those companies can't do great things. It doesn't mean that they can't be socially responsible. But the reality is they have a fiduciary responsibility to their shareholders. Well, social enterprise has to be in the hands of an organization who has a fiduciary responsibility to fulfill a social mission. And so the wonderful challenge and excitement that comes to be when a not-for-profit who has a fiduciary responsibility for a social mission and organizations that are for-profit and therefore have a fiduciary responsibility to shareholders come together, if there is going to be a true social enterprise, then the requirements for excellence or quality need to be in the hands, we believe, of the not-for-profit. And so we require of all of our social enterprise partners that they have to meet a set of standards of excellence that are relevant to that area. And in the case of our evidence-based work of social enterprise, they also have to meet fidelity standards. So if we can go to the next slide, I'm really not going to go into this much at all, but it's I just wanted to point out that while we don't talk about it much, I know some of you know our partnership with Stanford has now morphed into a strategic enterprise with Canary Health. And you may or may not know about our social enterprise with Aon Retiree Exchanges. I encourage you to go to mymedicarematters.org and learn more about that. And some of you may have known that URL for a long time. But we've also been doing another social enterprise with Fannie Mae in terms of default mitigation and counseling. So we now have 3 social enterprises going, and there's at least 2 more that are likely to come online this year. So we are all in, so to speak, on using social enterprise to achieve our social mission. And part of that came when we realized that that just doing things the way we had been doing it, mainly through grants-based work, we would not achieve our 2020 social goals, our objectives of significantly improving the health or economic security of 10 million and older Americans by the year 2020. And so what I'd like to do now is is switch over to sort of more granular things about kind of what we're learning and sort of about doing the work of being in business as opposed to sort of being in the grants business. I know some of you that are on the line, you've been doing this for many years. For others, some of this may be new, and for yet others, just pieces of it may be new. So again, I'll go through it pretty quickly, and let's start with the whole question of business planning questions. And just so the moderator knows, I lost contact with the webinar, so I'll just call off page numbers. So right now, I'm hoping that we're on slide 10, business planning questions, and there's a number of questions related to thinking about being in a business. And the first of these really is, who are you going to sell your service or product to? And it could be that it could be that it's an end user, a consumer. It could be, and it's more likely, that it will be a corporation. But then the question is it the corporation? Are you going directly to the end corporation, if you will, that you're selling to, or are you selling it to another organization that's bundling and aggregating? Very, very important to kind of figure out over the time, what your role is. If in fact you've made the decision that you're going to sell directly to the end purchaser, then a couple of questions come to mind that you don't have to answer if you're partnering with somebody that is doing, in essence, the final selling to the purchaser. One is, do you have a broad enough offering for that type of purchaser? There are a lot of organizations that don't want to buy one product. They want to buy a suite of products, or they don't want to have to deal with multiple vendors. So that's a question to be thinking about. And it's also a question to be thinking about in the context, and we'll get to it in a few seconds, of who are the best customers that I could likely align with. The second and related is my service scalable enough to meet the needs of that particular kind of purchaser? Are they a purchaser that will require community locations all over and be done with it? Or are they a purchaser that says, no, with my constituency or with my enrollees or with my patients, fill in the blank, a whole bunch of them want to use the internet and don't want to go to a time and place location. So do you have a solution for that? There are going to be others that say, my constituency, while they tend to be lower income, use mobile phones a huge amount. So do you have something that helps using the mobile devices? And then the last two bullets there really go to being honest with ourselves and really trying to take really hard looks and asking ourselves, who are our competitors and how do we stack up against them? And as you all know all too well, we are entering into very competitive spaces. And then what are our or your sustainable competitive advantages? And one thing I would suggest that don't underestimate is your brand, is who you stand for, is the fact that you are part of the network, is the fact that you didn't go into business to make money. You went into business to serve a social mission. Don't underestimate the value of that, as long as you also have learned how to be bilingual and how to speak business and be bicultural and be able to and be comfortable in the culture of business. If you go to the next slide. So can you just give me a little feedback? Are we on business planning? Questions continued?
Slide 11, yeah.
Great, thanks. And so, so there's a number of other questions that have to do with how am I measuring my success, both in terms of social mission, and at NCOA we got very, very specific about that in terms of what that meant. And then you need to ask yourself kind of the business questions. So what volume is feasible? What price is feasible? A very important component of all of this is really understanding and getting really granular about fixed costs and variable costs, so you have a really good sense for how much you have to charge and what scale you need in order to break even. And related to that is, since very few people can start a business and have it cash flow positive from the get-go, how much capital do you need to in fact break even, and where do you get that capital? I don't have to ask the question, can we bootstrap it, because we're all in the aging network, so we've been bootstrapping since the beginning. So for us, that's not even a new question for any of us, and I suspect on the phone the same thing. Where do we get the capital is an interesting question, and when you think of, don't think well beyond the normal places of capital. There's a whole area now that is investing in social enterprises. And that field is burgeoning. They will expect that you have business acumen, and so the work you're doing here is going to make you much more competitive in that world. But also think of your grants as a possibly different thing than you may have in the past. Think of them first and foremost of achieving the objectives of the grant, but also ask yourself, okay, are there things that I can do in that grant that will still have me meeting the objectives of the grant, that in fact will be a set of tools, that will be a set of processes that will also be useful in the business, and so that you wind up getting a twofer out of your grants. And then you start thinking much more strategically about your grants itself. So let's go on to the next slide and talk about the customers to focus on. And this is challenging because when you're first starting out, you want to get anybody that you can get in the door and start off. I get it, live there. But looking at this one is sort of a helpful thing, because each of the types or examples of customers that's on that slide will have a very different set of requirements. You'll have a better fit or a worse fit with, and that it's really important to ask yourself, can I be successful with that particular sort of customer? And then you may then need to ask yourself another question. Oh, I can, but that would require me to include an additional sort of venue, whether it's online or whether it's some other partnership that you would need. And so this is going to be just this iterative process that you're constantly going to be modifying, ruminating over. But if you always connect this back to the other things that we talked about, you're going to be in good shape. And these all refer to as segments of the market. And you can go to the next slide, please. But it's really not just about the segment. Even once you've decided on the segment, there's different doors. And a good example is a health plan. And I know many of you already know this, that there's the community benefits side, there's the medical management side, there's the care integration side, there's the marketing side, and all of those are very different doors. And that the door you go through is going to really help you answer a set of questions that will more likely help you get to yes with those, because the door you go through really will determine the price point, because they're used to paying a certain amount. It will help determine the kind of scale or size that could be. It will also help you to determine what the likely sales cycle is, and this is the piece that, as you're discovering, I'm sure, is the toughest to swallow, and that is, in this area, the sales cycle is painfully slow. There was a period in this journey in the early days that I was likening it to watch glaciers move. But you need to anticipate that, and you need to, but some doors have faster sales cycles than others. And again, the question of competition. The next point's really an important one, is will that door be okay with and relish us being what I call a one-trick pony? In other words, I have evidence-based workshops, and that's what I sell, and I don't sell anything else. Or I sell transition care and evidence-based workshops. So will they allow you to sell that? And also, there is no wrong door. And so it could be that you go in a door, and that person, they get your message, they get what you're trying to do, but it's the wrong door, so they introduce you to another door, and you've created an internal champion. So there really isn't any wrong door. And this is not regard to any past or present federal policy. And then the sentence in bold above that, what should you be selling? And so if we go to the next slide, I love this quote. I heard it about, God, it must have been 35 years ago, but it so resonates with me. We manufacture lipstick, but we sell hope. It's really important to know the distinction between what you manufacture and what you sell, because what you manufacture is about you, but what you sell is about your customer. And so you really, really need to understand what your customer is buying from you. Are they buying a halo effect from the partnership? That has a whole different set of issues and dollars associated with it and how much you can expect from it, et cetera. Are they satisfying a community benefits requirement? Because they're a not-for-profit hospital, and therefore, and they're in a state maybe like California that's taking community benefits in a very serious way, or indeed is it just not that at all, that they are totally driven by health outcomes or reducing A1Cs and getting better stars ratings, or have you really walked into the marketing and sales door, and what they're really interested in is retention and loyalty. So all of those things, and probably 9 others that you can think of, are really important. And as you're thinking about the customer, so you really understand how to price your product and how to pitch your product, because it really is hard, if not impossible, to have the right price or make the right pitch if you don't know what you're selling. And so sort of speaking of selling, I want to just spend a few seconds talking about sales flows and about sales. I think this is an area where my observation is that we in the network are most unfamiliar with. And so if we can go to the slide that says some thoughts about developing a sales flow. I borrowed something from a Nike commercial, just do it. Just go and do it, swallow hard, but don't, if you can avoid it, don't do your practicing on the big fish, because like anything else, you're gonna have to build competence and confidence, and practice will make perfect. The other thing that I'm sure you are all finding is that initially the key executives in the office and in the organization are going to be the ones doing the selling, and that's almost always the way it is, and it's been my observation, and we still do it at NCOA that way. And yeah, as you get bigger and as you mature your businesses, you then bring on people whose that's their day job, but you can fully expect that. Every time you have a session, really ask yourself, what did I learn? How do I modify? If you're using the sales pitch at the second meeting that you used at the first meeting, then you haven't learned. Then you're not getting better. So and so learn from each pitch. Learn what worked, what didn't work. Be really honest with yourselves, and then keep iterating. As I'm sure you're all well familiar with, multiple meetings, but go into each meeting with, if you can, a realistic goal. It's not going to be in the first meeting necessarily to close the deal, but it could be, my goal in this meeting is to learn more about what their needs are, or it could be something else, but get really clear about that. The other thing that will become really important, and it probably is already to some of you, is that there's lots of opportunities to get indoors. And the real question for you, sooner rather than later, is, because you only have a finite amount of time, you only have a finite amount of resources, and that is, what do I start needing to do to actually qualify leads? Are there 3 things that I need to know that if they don't say yes to all of those, the likelihood of the time being well spent is not good? And then at some point, when you've had a modicum of success, it will be really important that this is somebody's full day job. I know that we in the network are so used to having everybody wear 19 hats. But when you really start going to a services mentality from a grants mentality, you really start to need to think about 1 or 2 folks that really need to specialize. And I would argue that, that getting business in the door is one of the first specialties. And the last point is, and it's a whole discipline unto itself, but you manage sales by process. It's like any other thing in business. You create a process, and you create a repeatable business process, and you refine that repeatable business process. And that's exactly how you improve your sales. So what I'd like to do now, and it's on slide 16, is give some examples of particular messages tailored to particular customers. Not that these are great ones, but it gets to the point of, you have to know your customer, you have to know their pain points, and then you need to make sure that that particular pitch sort of reflects that. And on page 17, this happened to be something that we were pitching the online Stanford programs, but we weren't pitching to a healthcare organization. We were pitching to an employer. And so it's really important because for employers, the return on investment isn't just healthcare costs. And so we had some relevant statistics and some really good conversation around that. If you go to the next slide, the next slide was something that was used effectively, with a healthcare system that, of course, was knee-deep in automating medical records, health information technology, meaningful use, all of this stuff. And so showing them that how we that were providing these evidence-based programs, regardless of whether the evidence-based program was online or community-based, how we could fit into their new world of health information technology. If nothing else, it said these people get it, they understand my world, and it'll be easier to work with them. And the final example on the next slide was something that, and this slide, by the way, took us about 6 months to figure out and get down, and it was, how do we explain what we're doing with My Medicare Matters in one slide and in 2 minutes? And so this is, if you will, the elevator pitch. In this case, it was for My Medicare Matters, but it's going to be, I think, really, really important. As you are refining the business that you're in, as you are refining the partners you're going after, that when you step in that door, that in 2 minutes you're able to explain exactly what it is that you're doing and how you'd like them to fit into that. And then I'd like to close with something that I actually don't remember who shared this wisdom with me, but it was about 40 years ago, 35 years ago, 40 years ago, and it's really great wisdom. And it particularly is so when it comes to either potential strategic partners or to selling a product, and that's on slide 20, that there really are 3 answers when it comes to sales or partnerships. And really, from my perspective, only 2 of them should be acceptable. So there could be yes, there could be no, there could be not now. And usually no should be seen as an unacceptable answer because there's probably a future time or a future relationship that could be had of that. So I want to thank you very much. I want to thank Marissa and the team at ACL for the opportunity to talk at you about this stuff, and I would just like the discussion to begin.
Great, thank you so much. So I would now like to, if the operator could please provide instructions for asking a question through the audio line.
Certainly. To ask a question, please press star 1 on your touch-tone phone, unmute your phone, record your name clearly after the prompt, and I will introduce you for your question. Your name will be required to introduce your question. Again, it's star 1 to ask a question. If you need to withdraw your question, you may press star 2. One moment, please, for incoming questions.
Great, thank you. So in the meantime, we did receive a question that came in through chat. And this comes from one of the members of our Business Acumen Learning Collaborative. And she says that it strikes me that volume is such an important aspect of successful enterprise. NCOA works at a national level versus the Business Acumen sites are operating more on a local, regional, or perhaps statewide level. Can you address the importance of volume and the issues around that subject?
Sure. So volume is absolutely critical, but volume is also relative. So a really critical part is understanding your business, understanding your cost structure, understanding your pricing structure. And by the way, in terms of pricing, I really encourage you to do two things when it has to do with pricing, and that is that you really understand your costs, and then you make sure that your pricing is significantly higher than your costs, because what you really are selling is value. And the reason I do that in the context of volume is because if for a given cost, if you can get a higher price, then you'll need less volume. But back to the question about volume, it really depends on your cost structure. It really depends on your product, and then a realistic assessment of how much flow you can have. That said, if it looks to you as if on a standalone basis you can't get enough volume yourself, then you can think about, well, can I have partners that can bring me volume? And because if I get partners that can bring me volume, then I don't need salespeople, I don't need this, I don't know that. So that's one thing. The second thing is, how do you increase your footprint? Well, you increase your footprint by being part of a network. And I know there's a number of folks now in the network and around the country that are trying to figure out, how do we go about creating, for lack of a better term, contracted networks of local agencies, so that we really expand the potential for volume.
Great, thank you. Operator, I'm checking to see if we've had questions come in on the phone.
Currently, there are no questions over the phone. Again, if you would like to ask a question, please press *1 on your touch-tone phone, unmute your phone, record your name, and I will introduce you for your question.
Great, thank you. So at this point, we haven't had other questions come in on the chat, and I'm thinking we might be competing with some end-of-summer vacations at this date, but that might be why we don't have as many questions. But just to give it a couple more minutes, in the meantime, I just wanted to quickly mention to everybody that is still with us that our next webinar is scheduled for Tuesday, September 15th at 2 o'clock, and that's part of our Health System Quality Measures series, and that webinar will focus on Medicare STAR ratings, and we have invited Tim McNeil to present on that webinar, and again, it's September 15th at 2 p.m. Eastern Time. So let me check back and see. We have no other questions on the chat function. Operator, I'll check with you one last time.
There are currently no questions in the queue.
Okay, thank you. Well, Jay, I guess you got off pretty easy today. But nonetheless, we would like to thank you again for joining us today and providing great information on the social enterprise concept. As Marisa mentioned, it was something that came up quite several times during our last in-person meeting. So we just wanted to thank you again. Thanks for all of our participants for joining us today, and hope you enjoy the rest of your afternoon. Thank you.
Have a great day.
This concludes today's conference. Thank you for your attendance. You may disconnect your lines.